When it comes to your health, it's not just about getting care when you're sick, it's about staying well. And as Medicare's annual enrollment period rolls around, it's the perfect time to check in on more than just your coverage. It's time to check in on you. I sat down with Dr. James Gerasi from Village Medical, who reminds us that preventative care is one of the most important appointments you can make all year. Dr. Gerasi, first of all, thank you for your military service. You served in the United States Army. You've been in combat zones, but somehow you're nervous when cameras were pointing toward you.
Yeah, absolutely. This is not something I do every day.
What you do every day is look out for the health care of seniors, and that started with the personal situation with your family.
Taking care of my mom, who was healthy her whole life, all the way up into her 90s, played tennis 3 times a week, and then she wasn't, which unfortunately is the case a lot. And when she did get sick, even though she was a career nurse and married to a physician, had a great primary care doctor, and had what we thought was the right insurance, it was kind of late to find out that she didn't necessarily have the right insurance for the resources she needed when she became ill.
Yeah, so this became your passion.
Absolutely.
All right, I remember growing up as a kid, we always thought going to the doctor was the hospital. There's a whole lot more in between today. So explain to us the model of Village Medical.
Yeah, so Village Medical, we provide comprehensive, patient-centered, community-focused, value-based primary care, and we do that with a team-based approach, utilizing a full team of specialists from physicians to advanced practice providers, nurses, clinical pharmacists, care managers, and other health specialists that surround the patient and give them the care they need.
If you ask most people, who's your primary care physician, like where would you go if you needed to see somebody, I think a lot of people will go, ooh, I don't know. Right. Instead, when something goes wrong is when we show up to a doctor's office, and oftentimes it's a specialist, and so we bypass the primary care physician who could have probably stopped you from needing that specialist. So explain for people who are kind of confused with that, what a primary care physician is for.
Most people, when they think of healthcare, they think of sick care. Which is, what do I do when I become sick? But really the key to your long-term health and better health outcomes is preventive care. So it's staying healthy, keeping yourself healthy, and also early diagnosis and management of chronic conditions, because we'll all eventually develop a chronic medical condition. So whether that's hypertension, diabetes, or another condition like cancer, it's important to be seeing your primary care doctor frequently so that they can do the appropriate diagnostic tests and screening tests so that we can catch those conditions earlier.
Yeah. Now during open enrollment is a great time for someone to make their appointment with their primary care physician, because you're trying to make decisions as to what your plan needs to be, and that plan needs to be based on where are you health-wise?
We strongly, as part of preventive medicine and our preventive approach, we encourage people to get an annual wellness visit. So come in and see your doctor. But we also encourage them to come in regularly to see their physician or their provider. If you haven't done that already, during the annual enrollment period is a critical time to do that, because as you try to determine what the right insurance is for you and what your care needs are, you got to know what your current condition is. And so if you haven't had that annual wellness visit, AEP is a perfect time to come in and get that done. So schedule it right away.
Yeah, all right. What preventive care does Medicare cover?
Most people think of their Medicare plan as something that covers them when they're sick. But actually, Medicare and Medicare Advantage and other plans within the Medicare payer profile will cover most preventive care. And so that's...
Yeah, it's cost effective to keep us healthy.
Absolutely. So they pay for your annual wellness visit. They cover vaccinations and immunizations, which are very important this time of year, flu vaccine, pneumonia vaccine, et.cetera. And they also cover other screening tests for those chronic conditions I mentioned earlier.
Yeah, heart disease, diabetes, osteoporosis, depression even, and even looking at your blood pressure, fall risk, and medication reviews as well.
Absolutely.
All right, wellness visit versus the regular checkup.
When I think of annual wellness visit, it's like the preventive maintenance you get on your car. You don't just go in when your car's not working. You should go in and get service done.
You don't want to be surprised.
Right, and so an annual wellness visit is like that. Most of the time they go to the doctors because they have an issue and they have a need. They need a medication refilled, or they're having a symptom, or they're concerned about something. So really the annual wellness visit focuses on that preventive maintenance, that preventive medicine aspect, and trying to catch things early and keep you healthy.
Life gets busy, we forget, and like I always look at when I get my reminders, and they'll say, you haven't been in since. I was like, I thought I was in like 2 weeks ago. No, that was 2 years ago.
Right.
But so
you're not alone.
Yeah, right. One thing you all will do is help with reminders.
We do, yeah. So we have technology that helps. We have people that help. We're constantly sending out ticklers to remind people to come in for their annual wellness visit. When you do come in to see us, we will encourage you to schedule your next annual wellness visit. We'll also try to keep you on a regular visit cadence with us, so that depending on your health conditions, we see you regularly.
Yeah, and encourage people to act now, because appointments can fill up fast. Don't wait until January. Early visits can catch health issues before they become more serious, and deductibles reset or new plan benefits begin as well.
Absolutely.
All right. Thank you very much, Dr. Gerasi.
Thank you.
To book your annual wellness appointment, visit villagemedical.com, villagemedical.com.